Well, are you or a loved one suffering from symptoms such as breathing problems, a runny nose, coughing, watery eyes, and sneezing? You're not alone. But are they allergies or something else impacting your body? Joining us, Dr. Ken Paris, the LSU Health Chief of Pediatric Allergy at Children's Hospital, to answer some of those questions. Thank you so much for coming in.
Thank you for having me.
When we think of allergies or anything, we think of spring, we think of pollen. So why is it this time of the year, you tend to see these symptoms, and what's going on that could be triggering that now?
Yeah, so we think about indoor allergies at this time of year rather than pollen or the outdoor allergens like you mentioned with tree pollen and grass pollen. This year, lots of cat and dog dander were staying inside, and then dust mites, which are probably the most common allergen inside of people's homes in the Gulf South.
How do you know if you do have these things in your house? Like, what do you tell your patients to try to get rid of them if they're in your home?
Yeah, we all have them in our house. So we all have dust mites. We often all have cat or dog dander just because people track it into our homes. And those can be big triggers for allergy symptoms in a lot of people.
So let's talk about what are allergy symptoms versus something else.
Yeah, so it's common for people to mistake the two, whether you have symptoms from allergies or symptoms from a common cold or upper respiratory tract infection that also can cause itchy, watery eyes and sneezing.
So how do you know?
The difference is going to be fever. So when you have an upper respiratory tract infection or a mild case of RSV or another common cold virus, you typically have some aches and pains, and then you also almost universally have a little bit of a fever.
So that is the key thing to know.
Definitely.
How do you know if it's a severe allergic reaction that you're dealing with?
So most of the outdoor or even indoor allergy symptoms don't cause severe reactions. Food allergies or medication allergies can cause more severe reactions where people have trouble breathing, they have facial swelling, and they almost universally have hives or urticaria in their skin.
Okay, so we know obviously with those things it's time to see a doctor, go to see a physician to have it dealt with.
That's right.
But do we live in a place that seems to trigger this more than other parts of the country?
Absolutely, and I mentioned dust mites specifically, the most common allergy for kids and adults in the Gulf South. They love humidity, and we have a high burden of humidity in Louisiana, and therefore dust mites are really prevalent compared to like Colorado or Utah where there's dry air and very low humidity.
Well, that explains why people travel out of town and they
That's
say,
right.
We felt fine, and then we got back here and then it started again. So my last question to you,
Yeah.
to try to reduce those chances, what do you recommend in terms of making your home clean of these things?
First of all, you need to know what it is you're allergic to. Otherwise, all those efforts are really for nothing. So if you know that you're allergic to dust mites, we have recommendations of ways for you to reduce your exposure to those things. Or for example, mold allergy or cat allergy, those have very specific targeted avoidance measures we can recommend that aren't necessary if you're not allergic to those things. So find out if you're allergic to those items and then do the work to reduce your exposure.
Well, thank you so much. Those are some really good tips because,
Sure.
everyone always has, it seems this time of year, something that they're dealing with. So
That's
I
right.
appreciate you pointing out the difference. Fever is a really key thing.
Fever is key.
It's not just allergies.
Absolutely.
Thank you. Have a happy holiday. Merry Christmas.
You too.
Appreciate it.